Jungmin Ahn, our practitioner and founder of Clinic.
Hi everyone, it's at 10 o'clock. We can start the webinar. Many of you know about me. I'm at the Silver Lake Clinic. I've been practicing acupuncture for 12 years. I graduated from last year and learned acupuncture from many different masters and doctors. So this is an overview of today's session. So I'm going to cover the pain theory 101 and pain relief formula and pain relief toolkit, and you have a chance to ask questions after that. But these videos are in YouTube at Silver Lake Clinic YouTube channel, so please watch the video there because I'm gonna just quick overview of these 3 videos. In session 2, we're gonna do demonstration with our patient and posture, proper posture, and some stretching and massage, and some lymphatic draining massage for the swelling. And then we do the stress relief exercise together. In session 3, I explain about how you can get the toolkit and then some virtual group care. And this is an overview of this today's session webinar. And it's about the 1 hour and 10 minutes. Hopefully I can finish everything in 1 hour. So this is one example that you can redirect energy. So our heart has right here, and our heart is a major organ for circulation. When you have an inflammation or pain, our heart becomes tense and tight, and then you can check this area. And many of you, my patient, and I did this one at the clinic, and then check this one here. And if you feel tight or tense, and then you can use this point on the upper forearm and like this area, and apply for like 8 seconds. But find the point around here, some tender point. And then once you find it, apply for the 8 seconds. Then recheck this heart area again. And a lot of people relieve tension immediately because the energy from heart can redirect to the forearm. This is things that you can do. You can do it by yourself. Okay, so I'm gonna quick overview. Or mouse is not working. So there's a videos at Silver Lake Clinic YouTube channel. So there's pain theory 101 and pain relief formula and pain relief toolkit, and please watch that video. And unblock the artery flow. So inside the vessel, and then there's some, if you have a plaque from cholesterol or swelling is pushing the blood vessels, and it blocks the blood flow. So sometimes the blood going to backward because they cannot flow. Sometimes they make a swole movement, and because this block flow, and it irritates the blood vessel and creating the pain. And nerve is like a wireless signal. So if there's nerve is blocked, pinched by the muscle tightness or swelling or inflammation, and nerve's signal can diminish or reflecting so that large part of information cannot be delivered to the ending cells. They're creating a lot of the pain. So the nerve compression, when you have nerve compression, you may have radiating pain, numbness, and weakness, and pins and needles. So my clinical experience, more than 60% of the pain is from the nerve compression. So it's important to relieve muscle tightness and reduce the swelling. Unblock the vein flow. Vein is only moved by the muscle contraction. So once it has a muscle contraction and blood is moving towards heart, it's in one-way direction. So let's see. So if there's a blockage right here, and then the vein is only moved by the muscle at the heart direction, so this one has accumulation. And this one creating the headache. So it's important to relieve muscle tension right here, so that you can have more blood flow in and from the brain to the body, up and down, so that you have better flow of the blood and energy, and so that you can have a less headache. So once you check your head, or temporal head, or back head, or front head, if you feel tight, that means there's circulation issue. So once circulation gets better with taking care of this muscle tension, and your head becomes soft like baby, that means better circulation, and then headache will be less. And lymph flow. Lymph is also only moved by the muscle contraction. So when you have a good lymph flow and it's less volume and the pressure inside, and external body fluid, which is swelling, can smear into the lymph vessels and to drain it. But if you have stuff or too much lymph is inside the vessel, and then lymph is going outside vessel instead of going inside the drain, they create the swelling. So it's important to relieve muscle tension as well. So this is about pain, how to take care of the pain. So redirect and balance. So once we have the neck pain, and sometimes our brain sending too much flow or too fast flow to that area that create swelling. So if we have a neck pain, you can redirect that energy towards forearm and the foot or hand or ear. It also contains whole body information, and so that it can redirect that energy flow to each location to balance it out, so that your swelling can be reduced. So our body has too much things to do, like cardiovascular, lung, and digestion or muscular system. And it's like our life. Our life has like working and paying bills and taking care of children or the housework, things like that. So when it gets chronic condition and body does not pay attention because it's always there, it's not important. So we need to give stimulation with this kind of tools to put there somewhere, and then we can give the brain, we can send a signal to brain to pay attention. And we are from one sperm and one egg. And so with the replication process, one cell is divided into two cells. And when we divide it, they all have hold the DNA information. And so that's why we can have DNA tests with single hair. So likewise, like DNA, whole DNA info duplication. So our each part of body contains whole body information. Forearm, this is the picture, and then there's a hand, and this one is contains whole body, left arm and right arms and things like that. This is an organ system. And so, for example, if we press this area, this forearm area, and even without touching the pain's location, we can stimulate that pain location. This is a neck part. So this is summary of the pain theory. You can watch the video in YouTube at Silver Lake Clinic YouTube. And this is pain relief formula. And this one is you can do it by yourself and everywhere and anytime. And you can use tools or you can use the thumb for acupressure. It provides immediate relief and is indirect and safe. So this is a form chart. And so this is your elbow right here. And this is your spine, and this is your neck area. This is your middle back, and yellow as your lower back, and sacrum as the orange as a sacrum. So this is about 20% and 40% of your forearm, and about 25% and 15%. So you can utilize a portion of your forearm to locate your pain location. So if we have neck pain, apply to here. If we have upper back pain, apply here. If we have a lower back pain, and apply on finding the tender point around here, you can use that one. This is front side of your body, and this represent your front side of body. So this is about your elbow, and this is your chest, and this is your abdomen area. If you have a digestion issue, you can find some acupressure point around here. And hand chart, same thing as here. This is a neck, upper back, and lower back. And so if you have a neck pain, and third finger, and then you can press around here and find the tender point. And then you can apply the tender, the acupressure there. This is your upper back. This is your scapular area between shoulder. And this is the front side of the hand. And this is your head. And this is your lung. And this is your digestive organs. And ear, same thing. And this is as the neck, upper back, the lower back. Between your upper back and your neck, there is a shoulder right there. And this is your foot chart. And then this is neck, middle back, and lower back. And then different side of a headache. If you have front headache, usually here, and apply this acupressure point here. If you have occipital headache, and side of your right here, you can apply it. You can find acupressure points around the circle area because energy moves time to time. So and the exact acupuncture point also can changes the location. And if you have a vertical headache right here, and you can use this point, finding point around here. If we have temporal headache on the side, and this point around here, can redirect the energy from temporal head to all the way down to the foot, so that it can relieve some temporal headache. Okay, pain relief toolkit. So some of you got this toolkit, but if you want to have this toolkit, you can order at the Silver Lake Clinic. And there is a chart that I mentioned, pain relief formula. And there's the 3D rolling massager. And I'm going to cover briefly about this is this acupuncture sticker. And there's the infrared hippo sticker with it. I call the O pressure. And there's a T pressure to find the exact tender point. And sometimes people doesn't have a good strength on finger, so I use this one to find. You can use this one to find the exact the tender point. Yep. So this is O pressure. This is an infrared hippo. I search everywhere, like United States, Korea, and China, to find a good the infrared hippo. This ball is best so far. So you can put this one together to here, and with when you apply to your body, like this, your neck area. With the body heat, it warms up the infrared hippo and then emit the infrared heat to the skin, muscle, and bloodstream and increase blood circulation. Yes.
There's a question from Laura Miller.
Who?
Laura Miller.
I'm gonna answer all the questions after this slide, and then there's a question and answer the sessions. So I'm gonna answer the questions there. And then again, if you have this massager, if you can find with your thumb. But if you don't have a good strength, also you can use this T massager to find it. This is also a very good tool to give the point massage like this, some point. And T pressure, this is kind of acupuncture needle, but it usually doesn't puncture into skin, and it gives a mild stimulation for like 24 hours. This is substitute of the acupuncture needle, and it's very good to relieve the local swelling. So if we have a swelling here, and then you can apply this sticker, and they will relieve some local swelling. And new pressure is. So I use this one where I cannot use the T pressure, like your hand area or your foot area is sensitive. So I use this one to give stimulation. And 3D rolling massager is like this. It's in the toolkit. And you can use this like massage here, or your temporal area, and your jaw area. And then you can do some STM muscle, or some like this, your pectoralis minor muscles, one here, cricoid process. And then since I briefly show you that this one is our spine, so you can stimulate like this area. to increase circulation on your spine. Yep. So unblock the arterial nerve flow, you can use this one, and then redirect this one, you can use the pressure and T pressure and then O pressure. Increase the vein and lymph flow, you can use this rolling massager, and you utilize the body interconnection. You have master chart like this, so that you can find where you can put the stimulation and intention. I'm gonna teach you how to do intention in section 2. All right, the question.
There is no question right now, but if someone has.
So I will give you unmute for everyone. And so if you have question, please raise your hand and ask me questions. Okay, Kirsten, you can come in.
Oh, Kelly, Sean has one question.
Sure.
How much that toolkit is? Do we need to order it ahead of
I
time?
cannot hear it. Hear it. Do you hear it? Hold on.
No.
Let's try.
Kelly?
Really, Sean? Yeah.
Oops.
Maybe from here. This one is connected with the monitor.
Okay, so can you turn off the audio?
Okay. Okay. What about now?
Okay, Kelly?
Hello.
Do you have a question? So he's asking how much is the toolkit and how long to get it?
Toolkit is $50. But we'll go over this one in the last session, and then it takes just 1 or 2 business days in Washington State.
Thank you.
Okay, any other question? Otherwise, we can go to the next one. We have a lot of things to cover. So thank you. Here's our patient, Kirsten, and I asked to come for as a model yesterday. So thank you so much for accept my invitation. Yeah, here. Hello. So I'm going to change the setting here, and they can help me. Maybe this one a little bit up. Okay, good. A little bit more zoom. Hopefully, yeah. I think we cannot see the screen. This screen.
Oh yeah, I can see it.
So a little bit more zoom.
Yeah.
So I'm gonna do the demonstration for side body, side of your neck, and the back of your neck and upper back, and the front side, your shoulder, and then your SCM muscle. So side, and there is some SCM muscle right here to this side. So you can do the massager. You can facing this way. Massage. There is SCM muscle, the attachment here and here. You can do the SCM massage. because SCM muscle is involved in every part of the neck movement, so it's important to relieve the muscle tension there. And SCM muscle is attaching to here, so you can massage here and let Kirsten do it.
Here.
Right, towards right here. Yeah, like this. That way you can stimulate the SCM muscle. And this is a scalene muscle. It's attaching to the bones and going to this one here and this one here. So between scalene anterior and middle, there's a lot of the structures here. Your artery, vein, nerve, and lymph. So if these two muscles is kind of tight, and that there's not good the circulation to the brain and back to the heart. So when that is the case, I use the T pressure, the acupuncture sticker, and please go to this. I think this way would be good. A little bit come here, great. So I check the first line, like from here to here, and you can press, and if there's some tightness, and if you do by yourself and push, and if there's tightness, you can apply it. This one. And there's the tweezer at the toolkit, so you can utilize this one. This you can apply them to the tender point. Okay. So since SCM muscle is attaching here, and you can use you can find point around here. This is your neck. This is your upper back and middle back. So you can find a tender point around here. So do you have neck pain on the left side or right side?
Left side.
Left side, good. So this is left side. So please find the tender point.
Right here.
Right here.
Mm-hmm.
Let me double check. Instead of this, I think this area is more pain. Yes. So usually towards bone is more effective than the muscle itself, and like towards bone, this area. But you can not just one location, and then you can find few different locations, and then find the most tender point and apply the O pressure. And this is you can put together with the ball, and then you can apply the please do yourself. When you do it, and then when you do it, and then there's you can do like this. If you do like this, and then you can easier to fit it. Instead of going this, you can just do it, and then it's easier. Yeah. And it's better to go with thumb, like this way. Could you go with this way? Yes, good. If you hold like here, then you can have more pressure. You can hold it, and have more pressure. And then find one more point around your upper back area.
Right here.
Yeah. So let me double check. And instead of here, I think this one has more tender. So if you're not sure to find a point, then use this the T massager and to find the exact point.
Yes, right here.
Yes. So this one is you can use like this, hold like this, then apply the pressure, the perpendicular. You got it?
Right there.
And but when we have an archery, and the 9, 10, there's a 4, 5 things. So even 1 millimeters make a difference. So once you find it, you can make some kind of this nail to mark or something, so that you know exactly where you can apply it. When you find it, if you apply it next to it, it does not as much effective. Yeah.
Yep, right there.
Yes. And remember the point. Yeah, then double check. That's very good. Thank you. Awesome.
Yep.
Yeah, yes. Yes. You can do like she did like this way, up and down, but it's good to have some kind of circular movement like this. Yes. When you doing this one, if you're not sure, and check your neck and then apply it and then move again. And now you know this one is helping you immediately or not. All right. And this is covered, but the SCM is right here to here, here to here. So here to here. So this is around this here to this here. So find around point around here, and that's the SCM muscle. And then please find out any tender point there.
Tender there. Right here.
Okay. So let's do here. Oh, you're doing good. It's good pressure and good support and pressure with thumb. So if you don't have the good strength, and then you can use this one. But when you use this all pressure, you don't need to press hard, because once the ball is hit up with a body heat, and automatically sending some signals to that specific location. So when you use this one, you don't need to press hard. And the back side of body is pretty common, because a lot of people has tightness right here. That's why we have some tension headache and upper back tension and things like that. So the back side of head is important. So here is the trapezius muscle. It's a splenius muscle, and this is SCM. It's all attaching. All attaching in this area. So it's important to relieve muscle tension right here, to relieve the upper back pain, neck and upper back pain, because this is all connected to here. So relieving this one is very important. And here is the small muscle is attaching to your C2, and that's why this area is very important to relieve tension. You can utilize this 3D massager. You can show how to do it by yourself. Yeah. So first you can do here from under the bone, like this way, and then the middle part, and then the close to your ear. And then if you have a tension also, you can do the side of the head. Could you do one more time?
So I would do this.
Oh, nice. This time is better. The middle. If we have a tension, you can do a little bit more massage there. But don't do more than 2 minutes, because the more, and then also it can irritate the nerves. So thing is, relieving the muscles, sub-occipital muscles group, then relieving the muscle tension is important. Yes. So not doing the more than 2 minutes. So this one is your lumboid muscles. So this one is your levator scapular muscle. So you cannot do by yourself in this area. You need to help with your family members, your husband and wife, or daughter and son. So if there is if you press a tightness here, you find it, and then you can apply to T pressure or like U pressure, so that you can relieve tension there. It's like having acupuncture for 24 hours with a mild stimulation is very effective. Yes, especially for the chronic condition. So this is a back of your head and upper back. And so since this is fresh, you can do this. This way. So if you have a upper back tension, you can find here, about to here. This is your neck and your middle back, 20% and 40%. So find the point and then apply it to all pressure. Or you can use this, the pressure. You can do pressure for a few seconds. Find one and check your neck before, and then with application, and then you can check your range of motion again.
Right here.
Oh, right here. And do. So it doesn't matter which one, the stimulation is important. So you can use just side pan. You can use suckle. You can make pan kind of things, and you can do little stimulation there. So either one is fine. So stimulation is important. It gives our brain, send the brain signal to brain to pay attention to there. If this one is relieved, and then associate location, your neck is also relieved at the same time. So this is hand. So we can do together. Checking I'm doing it right. And kind of this squeezing, this is your neck area. This is the middle back area. And you can go this way. Yeah. So when you have tension on your neck, this area becomes tight. I checked right before the webinar. I checked her the condition. This area was, since she has a pain on the side, this area was tight, but this upper back was okay. Yeah. That's your body indicates your older condition. Yeah. So sometimes even without asking questions to patient, I know, because when I touch it, and then it shows their condition. This is side of the back of the body. And please come here, this way. So this is your neck. This is your upper. Could you zoom, Andrea?
Yeah, of course.
This is your neck. This is your middle back. And right between is the kind of shoulder. So it's just tight. So press this until you feel less tender and tight. And sometimes just takes some like few seconds, sometimes takes some like 1 minute. But once you do it, it relieves pain. And less pain means better circulation. Well, but it takes a long time for you. You have your attention. Okay, and check on other side too. So this is things that you can do, like, you know, when you drive between the traffic, when you wait for the traffic light, and you can use this one. And this, your low back is tight too. This area is up. Could you zoom out again? So this area is your lower back. So when you press, if it is tight, going this way, down this way, when you have tightness, and then that indicates you have some lower back tightness, you can apply acupressure there. And in order to redirect energy from the backside to here, it's called urinary bladder meridians. The slide is not here today, but you can check around this area. This way.
This one?
Yeah. Could you go down? And this time, since this is extremities and it's more sensitive, so I'm gonna use this one. And you have tweezer. So take this one out and make some little like this. And then find the tender points around this area. Could you go a little bit down more?
Yeah.
This area, and then you can apply it to yourself and find the location and apply. Today's you're not bad.
Yeah, today's not as bad. Right here.
Yep. This is the exact UB62 acupuncture point.
Oh, did they just come off?
Yep. It's easy.
You know.
Please use this tweezer, because once you use your the hand, it's kind of oily, so it reduces the stickiness. So it's better to use the tweezer to apply it like this. This one again sometimes takes some few minutes to relieve the tension. You know the tightness and tenderness right there because you touched it, and it takes sometimes a few minutes and few hours. But when you recheck again, if that is relief tension, that means a better circulation on your the back. Yes. If you have temporal side or temporal headache or it's the side pain, this area is very good. Oh, can I see it? So it's between here to here, and right between this, between fourth and fifth toe, there's a tendon right here, and you can find it. Just behind the tendon is the right point. So, but you can find the points around here. Three times. This is right here.
More out here.
Yeah.
There. Need it to stick. Okay.
All right. So if you don't know about the point, just search around and then find the tender point is applying the point there. And then check and recheck. If there's a less pain, that means a better circulation. So front side. So front side is posture is important because a lot of time, you know, we do computer work and cell phone work, our posture is going like this way, and your the scapula is rotating in this way. So making proper posture is important. But since your posture is folding like this way for a long time, you can do this shoulder exercise, a little bit this one from small circle. Can go to the next level, and then you feel some tightness here, and then you can do more that area, and then once you get one without the tension, you can go a little larger circle. And do this way too. And you can do freestyle. You can move anything in like this. The matter is we relieve the tension in right here. So people with have neck pain, and like 70% people, they have a tightness here. But this muscle is attached in this area, so it's good to massage around the chest area as well to relieve tension right here. You can also apply the hip pressure on where you have muscle tension right here or this area.
On average, how long should we apply finger pressure on a tender point?
How long should we apply the finger pressure? About 5 to 8 seconds, and you can apply the pressure and check the range of motion again, and most time is an immediate relief. So
is harder pressure better?
Harder pressure better. I don't know your hardness, but I know my hardness. But the matter is, you can navigate, you can find yourself what would be the best pressure. So you can try this, and check your range of motion or pain level. So if that is less the pain, I think this is right pressure for you. So everyone has a little bit different definition of the pressure, so it's hard to answer. Yes. So once you practice, you know it. So you can apply this one to this area. And the front side, so this is a front side, and since this is a front side, and you can find tender point around like this area, and you find the tender point over here. It's below elbow because the chest is below elbow. As you can see, this is the neck, and this is your side of neck. This is junction, your neck area. This here, this is your the elbow area. Yes, we can find this point and to relieve on this area pain. Yeah. So we have 20 minutes left, and this one is some breathing with the intention. So when you do it, and then kind of inhale and making connection with the pain's location, and when you exhale, let tension out of your body. So we have a powerful intention. So once you believe, once you think, the energy follows. So this is a good way. The intention doesn't cost money, but this is very powerful. There's 2 other methods, but we had other things to cover. So I'm gonna do the next slide. Okay, thank you for your demonstration. And okay, thank you. Let's make the slide back with yeah. Meanwhile, if anybody has any questions, we need to reset one. Sure. Let's put this one really close. So posture is important in our lifestyle, and working posture, and walking posture, or the sleeping posture. And this actually creates a pain because this is life things. So if you sit like this way, or going back one slide, if you look at like this one, and that creates a neck tension. So you need to have a proper monitor eye level, your eye level, and then your back straight. That's important. But sometimes we cannot do it, so it's good to have some shoulder corrector and use for like 2 weeks to recognize your posture is going this way or not. I tried it. Shoulder corrector itself doesn't change the posture, but it make awareness your body is going this way. So again, this exercise, keep doing it to if you have the poor posture issue, and then make sure when you have cell phone and you don't do this one for a long time. And when you have a sleep, and we spend 1/3 of our life sleeping, so imagine you do side sleeping for 8 hours, and you're gonna have a neck tension. And if you have a high pillow, it's like this way for a long time, you will have a tension right here as well. So sleeping posture is important. So no matter how expensive your mattress is, and proper pillow would be the better options. So right ergonomic your neck, and then there's some back support, the pillow, and then some supporter from your knee. If you buy the proper pillow, it's better than buying the expensive mattress. So lymphatic drainage massage.
There is a question.
Sure.
If the right side neck hurts, it is better to apply pressure to the spot that hurts, or a location on arm, hand, or foot?
Everybody has my clinical experience. Everybody has different response. That's why I include the forearm and hand and foot and ear chart. But easier things you can do is actually in your forearm, because it's easy to reach. And then you can try this one first, but if it doesn't work, you can go to the ear, to another part of the body. So since this one is easier to apply, I tend to use more on the forearm chart. Is it right?
Yeah.
Okay.
Like it.
So, and there is a lots of the lymph node and lymph vessels, and there's some YouTube in here in Civil Lake Clinic. I need to upload it. It's gonna be uploaded soon. So I just go briefly about how you can do it. So this stretching, you can do like this way. And once you move your muscle, remember, and then that improves circulation on the lymph and vein. You can kind of this one making you move. When you have a swelling on your arm, you can do this way. And when you have a swelling on the foot, I don't know, I can do it. You can go down a little bit. You can go like this way, and that makes some lymphatic drainage. Go here, things like this. And what there is how to use in the it's gonna be YouTube. But one thing is this area is your clavicle area, left side, is the only reason that lymph and vein mix together. So there's a lot of clot sometimes and swelling here. So good to open it up this area. So the left side, right above the clavicle, and then you can good open it towards your heart. Either your thumb or the one. But when you have a lymphatic drainage, it has to be slow and not hard. When you apply to hard pressure, lymph gonna be high, and there's it's no good. So slow and feel the water movement under the skin, and that is better. This is lymphatic drainage, and this is some abdominal growing drainage going this way to this way, and the abdominal drainage and going this way. Yes. So stress is causing the pain, as you know, as you experience. And some people hold their stress on the upper back and neck, and some people hold their stress on the lower back. So this is good exercise you can do to relieve headache. So if there is a stressful moment, there is a 90-second rule. And so if you can hold the stress for 90 seconds, the stress relieve by itself. So when you have stress, you can go to the restroom or some private area, and you can do this and breathe in. You can zoom out, breathe out. It's better to bend your knee a little bit. That relieves some abdominal muscle tension. So breathe in and breathe out. When you have the stress, the energy is going like upward emotions. So by doing this, it redirects your upward emotion to downward. And then deep breathing is the fastest way to relieve the stress. This is inhale, and here to exhale. And breathe in. You can do by yourself. Breathe out. And then stress is holding the side. So we can do this and opens up and goes to the back and breathe in and stretching and hold as much as you can. Hold and go back. Breathe out. One more time. Breathe in. Hold. Come back. Breathe in and stretch and hold. Done. Exhale. And then shake your hands and then imagine your bad energy or negative thought, all things is moving towards your fingertip. And shake it up and shake it out. One more time, your bad thought and negative energy towards your fingertip. Shake and shake it out. Yeah, this is about 90-second simple stress exercise you can do. So lever 3 is the point right here. Right here is between your first and second toe. If you follow the bones, and there's a point right here, that's the lever 3. This is excellent point to check your stress level and treat the stress body reactions like hypochondriac pain, indigestion, and sudden anger and things like that. So this is a very good point to apply for stress relief. You can do some deep breathing, and so with the right posture, and then you can do deep breathing together. Also, it's natural breathing. And breathing in, and your breathing is going all the way down to your lower abdomen, and breathe out. First, it's better to use your mouth to empty your air completely, and then once you get used to it, you can do nose breathing. When you're breathing in, energy go all the way down, abdominal breathing, and breathe out. Your abdomen is contract. When you completely exhale and do wait until your body need air.
We have 2 minutes.
Oh, we have we go 11 to 10. So I've got to quick. It's a deep breathing, relaxing, but it's we need to fast. So after exhale, wait until you feel you need air. It's natural breathing. And also between exhale to inhale to exhale, also there's a pause so that you can have some natural breathing. I think I need to have this session in YouTube to explain further. So deep breathing is the fastest way and very effective way to relieve the stress in meditation. So if you like this webinar and then if you want to purchase a toolkit, and Silver Lake Clinic has the option to purchase it. You can purchase here. We send you a link with you can purchase the webinar with you can also it's including the toolkit. And please use the discount code Hilland for the recording, because if you use this one, you get the 20% off. And after the webinar, you will have a lot of questions how to do it. Am I doing them correctly? And so my clinic, even the first webinar or second webinar, they still have a question. They cannot do it. They cannot find the chart and things like that. And this is things that I can cover in the virtual group care and some pain relief and stress relief and things like that. And if you have any question, you can bring the question to us. And if you have the neck and upper back or the pain condition, you can bring that one to here so that other people can get the the information shared together. And it's also in our website. This month is free, so no need to pay it for trial. And if you check out, and then you will get this kind of email, and there's the link to join and the password. And actually, you can use this link, and we need to probably share. I will share this email to you so that you can have a free trial. And Silver Lake Clinic, we brought the mask from South Korea, and so this Friday sales is going to be only $165 up to. We sell in the mask, and then you can buy the mask from here. It's very cheap price for the very good mask. So thank you for watching. So be sure to follow us on the Silver Lake Facebook and YouTube. There's going to be a lot of information. Please stay updated. And now you can ask another questions.
Yeah, Kelly said, thank you, Jungmin, and those who helped create this presentation.
All right. Yeah, thank you. Thank you for watching. If I remain here for about 5 minutes more, and if you have any question, otherwise I will see you next time. Thank you.
Oh, Kim has a question. She says, can you pressure both ears at the same time?
Can you press both? Oh, both ears? Yes, you can do the both at the same time. Yeah. So when you have this is neck and upper back pain. When I have low back pain, I press this one at the same time. I move your low back. I think same things. I think you can do press on the neck or upper back or shoulder area, and then you can move your neck. Yes. And some people have immediate relief from the pain and tension with just ear acupuncture. You can press the pressure, or you can use the acupuncture sticker there to relieve the tension there. Yeah, if you have any question, and then please join. It's a virtual group care. Here. Oh, no, not here. Here, and then bring any questions. I'm happy to answer. All right. Any other questions? Okay, thank you, everyone. Bye-bye. Can close.
Do you think the person that had the question in the beginning, Laura